Angiosarcoma is a rare and aggressive type of cancer that originates in the cells lining the blood vessels or lymphatic vessels. This malignant tumor can occur in any area of the body, but is most commonly found in the skin, breast, liver, and deep tissues. Angiosarcoma is difficult to diagnose early because of its vague symptoms and fast progression. It often spreads, metastasizes, to other parts of the body, such as the lungs or liver, making treatment complex and challenging. There are different types of angiosarcoma, depending on the affected location. Cutaneous angiosarcoma is the most common and generally appears on the scalp or face, particularly in older adults. Breast angiosarcoma often occurs in women who have previously undergone radiation therapy for breast cancer. Hepatic angiosarcoma, which develops in the liver, is rare but highly aggressive. Cardiac angiosarcoma affects the heart and is another rare, yet particularly dangerous, form of this cancer. The causes of angiosarcoma are not entirely understood, but several factors have been linked to its development. Long-term exposure to radiation, especially for cancer treatments like breast cancer or Hodgkin's lymphoma, increases the risk. Some chemicals, such as vinyl chloride and arsenic, are also associated with hepatic angiosarcoma. Chronic lymphedema, which causes fluid retention and swelling of tissues, particularly after lymph node surgery or radiation therapy, is another known risk factor. In rare cases, genetic mutations may play a role, though most cases of angiosarcoma appear to occur sporadically. Risk factors for developing angiosarcoma include prior radiation treatment, particularly for breast cancer, and exposure to certain environmental toxins. Additionally, patients with chronic lymphedema, such as those who have undergone surgery or radiation to remove or treat lymph nodes, are at higher risk for developing this cancer. Age is also a factor, as most cases occur in individuals over 60. Though the condition can affect anyone, its incidence is higher in people with a history of cancer, or those exposed to chemicals used in plastic or agricultural industries. The symptoms of angiosarcoma vary based on its location. Cutaneous angiosarcoma often appears as a bruise-like lesion or a reddish-purple patch of skin that may bleed easily. In cases involving internal organs, symptoms are generally more severe and may include unexplained pain, fatigue, or weight loss. Hepatic angiosarcoma may present with abdominal pain, jaundice, or liver enlargement, while cardiac angiosarcoma can cause chest pain, shortness of breath, or arrhythmias. As these symptoms are often nonspecific, angiosarcoma can be misdiagnosed or identified only in advanced stages. Treatment options for angiosarcoma depend on the size, location, and stage of the tumor. Surgical removal of the tumor is the primary treatment, especially if detected early. In cases where surgery is not possible, radiation therapy may be used to control tumor growth. Chemotherapy is often administered to patients with metastatic angiosarcoma, or in conjunction with surgery, to prevent recurrence. Targeted therapy, which focuses on the specific cancer cells, is an evolving area of treatment for angiosarcoma, although it is still being researched. Because of its aggressive nature, angiosarcoma requires a multidisciplinary treatment approach to improve survival chances. Surgical management of angiosarcoma typically involves wide excision of the tumor with clear margins to reduce the risk of recurrence. Depending on the location of the tumor, reconstructive surgery may be necessary. For example, in cases of cutaneous angiosarcoma, skin grafts or flaps might be required after tumor removal. If the cancer affects a major organ, like the heart or liver, more complex surgeries are necessary, often involving cardiothoracic or hepatic specialists. Surgery is often followed by radiation or chemotherapy to eliminate any remaining cancer cells. In terms of nursing care, managing angiosarcoma patients involves addressing both physical and emotional needs. Patients undergoing surgery may require extensive wound care and monitoring for infection or complications. Post-surgical patients are also at risk for delayed healing due to the aggressive nature of the cancer and the potential for recurrence. Nurses play a crucial role in managing pain, providing emotional support, and educating patients and their families about treatment plans. Nutritional support may also be necessary, especially for patients undergoing chemotherapy or who have difficulty eating due to the location of the tumor. Regular monitoring of vital signs, wound assessment, and administering medications, such as pain relievers and antiemetics, are part of the care plan. Emotional support and psychological counseling should also be available to help patients cope with the stress of their diagnosis and treatment. Subscribe to us for more videos like this and visit bazaarbiblio.com for notes and free PDF books. Thank you.